Welcome everyone to the Catskills Addiction Coalition's week of community action around preventing, treating and helping people in recovery with substance use disorders and addiction. I'm Diana Mason. I'm co-chair of the Catskill Addiction Coalition. And this session this session is being recorded. If at any time you would like to make a comment, but you don't want it on the recording, you can ask me to pause it, and we're happy to do that. This session will be for 1 hour with opportunities for everyone to interact. The first opportunity you have is the chat box. If you go to, depending on your display, it may be under more. You can post questions and comments in that chat box. We'll be able to save it and download it. You can too. If you go to the end of the chat box, you'll see some buttons down in usually the lower right corner, and you can click on those and usually can save it and then download. It'll download it, and then you'll be able to have the link. So there will be a Q&A at the end, but if you have questions throughout, Courtney's willing to entertain questions throughout, and I'll be moderating the chat room. Now you can also raise your hand. There is a raise hand function in Zoom, but if I'm monitoring chat, I may miss it. So if all else fails, you can unmute yourself and just jump in with a question. When you do have a question, please introduce yourself before making a comment or asking a question. I'm going to ask that everybody mute themselves until you want to speak. Again, we're recording this session, and it will be available afterwards on our website. And you have to give us probably about a week to get that link posted, but we welcome you sharing it with other people as well. We really want your feedback on this session. The Catskills Addiction Coalition has a number of sessions this week, and we have a standard evaluation form for these Zoom sessions. But Courtney Hayes has her own evaluation that she wants to use for this. It's more detailed and it's excellent. And I'm going to ask everybody to do that evaluation form. I'll be posting a link to that at the end of the session for you to click through. Also, you'll be able to get Narcan if you complete this hour, but you must complete the hour, and we'll be posting the link for you to get mailed your Narcan at the end of the session. You can also get a certificate of attendance of this session. We will be posting, I'll post a link to a form that you'll complete for the Catskills Addiction Coalition that will then, you'll get automatically by email a certificate that saying you have attended this. So we want a few ground rules. One, we encourage your active participation. Two, we ask that you be respectful at all times of everyone in the room. You can feel free to disagree, raise a point that may be uncomfortable for some people, but always do so with respect and with care and with love. We want this to be a model of how we should be behaving in our society. Third, please help us minimize distractions by keeping that microphone unmuted. I will mute you if I'm hearing noise from you and you're unmuted, but you can then unmute yourself when you want to talk. I will be moderating this session. I'll do my best to get to your questions and comments, but know that all comments will be important to us. We'll share those with Courtney as well as TruthPharm and with the coalition as a whole as we evaluate this session and respond to questions and concerns you have. If I miss a question or comment, we'll try to get to it during the Q&A, and you may have to just nudge in. Finally, all questions are welcome. If you have a question, likely somebody else does. But you may have a burning question as we're going through the session, and I'm going to ask Courtney Hayes, who's the presenter this morning, to feel free to say, can we hold more questions until I get through more of the presentation, and then we'll take the questions at the end. We want to make sure she has enough time for this presentation. We are very excited about this session, and to provide us with this session, we want to welcome Courtney Hayes, a licensed master's social worker from TruthPharm, and TruthPharm is based in Binghamton, New York, but the Catskills Addiction Coalition has been collaborating with them in a number of ways, and we're very grateful to TruthPharm. They're a great organization whose mission is to raise awareness reduce the stigma, educate the public, and advocate for policy changes to reduce the harms caused by substance use. So we are grateful to TruthPharm. We're learning a lot from you. And thank you so much, Courtney, for being here today. And I'll turn it over to you.
Thank you so much, Diana, for setting up some ground rules for chat and everything, and for introducing our organization. I really appreciate that. So like Diana said, I'm a licensed social worker. I am here today very happily representing TruthPharm in my new role as a coordinator with the agency. Part of our work to reduce the harm caused by substance use is to ensure that communities have access to Narcan. So today I'm going to be going through a little bit of the science behind substance use and addiction and how it impacts the brain, as well as how to recognize an overdose and respond with Narcan or Naloxone. So we're going to start by giving you kind of an overview on the way that this has impacted the United States. We've seen a steady increase in deaths due to overdose since the late 1990s, with exponential growth since about 2012, 2013. It's just skyrocketed in almost a straight upward trend since that point. In 2017, over 70,000 people died from drug overdose in the United States. To provide a sense of scale, the population of Delaware County is about 48,000 people. So that's more than the entire population of a county in New York State. Deaths have increased so much that as of 2017, a drug overdose was the leading cause of death for people under the age of 55. This means if you hear a news story for a sudden and unexpected death of a member of your community with no indicated cause, statistically, the most likely cause of death was a drug overdose. In the midst of COVID-19, initial reports are suggesting that 2020 has broken current records for the most overdose fatalities within a 12-month period, which only drives home the importance of providing this medication to our community. And it also tells us that this is not something that's going away without a lot of work in communities and from agencies like this. Ooh. Okay. To offer a global perspective about overdose, here we see the United States is sitting at number 1 in drug-induced deaths per million in the population. As we look at countries with far less deaths associated with substance use, it's important that we not get discouraged. These lower numbers don't mean that substance use and addiction aren't present. It just means that countries have taken a different approach to handling that, and that gives us hope that the United States can do the same. In fact, Portugal, who you see sitting at the lowest on this list, had experienced their own drug epidemic, and they greatly reduced the prevalence of fatalities over the course of 3 years by decriminalizing substances and focusing on individual and community health instead of the punishment and surveillance of people who use drugs. So I say all that to tell you there's hope that we can do something different. We just have to do it, to force it. So with that perspective in mind, we're going to take a little bit of a look at the science of opioid addiction. So our bodies have naturally have systems in place that allow us to experience pleasure and pain that are connected with our ability to survive. When we do something that's good for us, our body releases dopamine. This sits in our opioid receptors, triggering feelings of excitement or happiness or that warm, fuzzy feeling that we all really like. This same exact process allows our body to regulate how it feels pain. Here I'll have you consider the runner's high. A person can train and be conditioned to run a lot of miles. Inevitably, it's going to start to hurt. For some people, maybe around the 10-mile mark, and for other people like myself, a whole lot sooner. Regardless of when that happens, the experience is going to be the same. You're going to feel stabbing pains in your ribs, your lungs are going to be on fire, your thighs are going to be burning, everything's going to hurt. The body responds to this pain by producing dopamine, that same chemical that triggers feelings of happiness in your brain. So not only will this produce a feeling of euphoria, that runner's high that we've all probably heard about, but it will also block out the pain that the runner is experiencing. With dopamine produced and sitting those receptors, the body can't send signals to the brain telling it that something hurts. To counteract this, because it's not good for us to not feel pain, the body also produces enzymes that break down the dopamine, clearing the receptors and allowing for pain signals to be received again. This is why when the runner gets home, they can evaluate their condition. Do they just need to rest for a few days, or do they need medical treatment for an injury incurred during the run? These enzymes and their breakdown of the dopamine in our system are important because it's just not reasonable for humans to feel euphoric all the time and also be unable to feel pain at all times. It would not allow for us to survive. Unnatural opioids, like painkillers and other drugs, have such a profound effect on us because they work within our existing system that impacts pleasure and pain. They attach to the same exact opiate receptors as our naturally occurring chemicals like dopamine. They're not working to prevent anything or counteract anything. They're just working with something that's already there. The enzymes that we talked about can't break down unnatural opioids in the same way. So the person using opioids spends a longer time feeling that warm, comfortable feeling, comparable to what's felt with natural dopamine production, and unable to feel pain. Combined, these things become really hard to walk away from. However, like we said, the brain doesn't like being unable to feel pain. It's just not conducive to survival. We need to know when something hurts so that we can address it and heal. So when opioid receptors are blocked consistently because a person is taking opioids, the brain just creates more receptors in an effort to receive those pain signals. We see this play out in people that experience chronic pain. For example, we're going to talk about Uncle Bob. At every family gathering, Uncle Bob tells the whole family about his back pain. It's the only thing he wants to talk about. Then one holiday, Uncle Bob shows up and he tells us that the doctor gave him a pill and his back is fixed. He's feeling great. Everything's wonderful. 3 months later, Uncle Bob tells everyone that his back hurts again. He's got an appointment to see his doctor. He expects it to be fixed. What's happening here is really that his back was never fixed. He was just given an opioid that stopped his brain from receiving the pain signals. The return of the pain is really his body and his brain working together to tell him, hey, something's wrong here, so that he can take care of the issue. So, feeling the pain again, Uncle Bob went to see his doctor to address it, to take care of the issue. The doctor increased his dosage of medication and everything feels fine again. He repeats this cycle every 3 to 6 months, consistently being given higher amounts of the prescribed opioid. The way that Uncle Bob keeps visiting his physician is really no different from the way that people who use heroin and other drugs continue to seek out that drug. They are just looking to feel normal and comfortable again. Along with the chemical responses that occur in the dopamine and the receptors, we see some neurological changes in the brain over time. Here we can see a piece of the brainstem, that's that part that kind of comes down and goes up into the core, the center of the brain. That makes up what we call our lizard brain. These are the most primal parts of us and the parts responsible for dopamine production and survival. In this part of the brain, we're hardwired to do things that are beneficial to our survival, and we're conditioned to do them because when we do, our brain gives us a shot of that dopamine, that feel-good chemical. The tasks that we're hardwired to do are getting water, finding food, having sex, and nurturing our young. That's it. That's all we need for survival. We're pretty simple creatures when it comes to those things. But what's really powerful is that none of these things that we're hardwired to do produce the same amount of dopamine as opiates. That's part of why they can have such a powerful hold over a person who uses them. The other reason that opiates can have such a powerful hold is that when a person uses opiates continuously, the brain senses the presence of too much dopamine. In an effort to return to a state of balance or homeostasis, the brain stops producing dopamine on its own. A person will no longer get that dopamine hit from eating a good meal or holding a baby, those things that are really tied to our survival. They will only receive that good feeling from continued substance use. Most people don't even realize this is happening, and they only find out when they make that effort to stop using, and they are hit with the sudden realization that everything is awful. It's terrible. It's sad. If anyone here has suffered from depression, that's your brain with some level of dopamine still going on, just less than other people have. A person who is stopping the extended use of opioids has 0 dopamine in their system. So you can imagine how terrible and hopeless that feels for them. And this overwhelming sadness that comes on when a person attempts to stop use is a really common reason that people indicate for their continued use or return to use after some period of not using. Here we see we see 2 brain scans that can show how drastic this rewiring can really be. So on the left side, we have a healthy brain, which has been presented with something that they desire but recognize as unhealthy. And we see that the brain is lit up. That's the person's judgment, motivation, and inhibition kicking in. So they might have been offered a really big ice cream sundae. Delicious, they want it, but they know it's not good for them. So their brain is processing, it's making a judgment. Should I have this? They're exploring motivation. Can I have this and then run an extra mile tonight to work it off and make it balance out? And they're looking to maybe exercise some impulse control over the situation. Maybe I can have half of this ice cream sundae. In the addicted brain presented with their substance of choice, these processes don't happen. It's just that lizard brain lighting up, tell them that they need this thing to survive. There's no other connection here between that core survival piece of the brain and the centers responsible for judgment, motivation, and inhibition. Over time, normal becomes redefined for a person using opioids. I say over time because there are so many factors that contribute to this change that there's really no defined time frame for when they occur. Factors such as age at the start of use, frequency and amount of use, route of administration, and co-occurring mental health concerns can all impact the way that continued use affects the brain. We're going to look particularly at 2 of these factors, one being the lack of use. That's what triggers the sudden sense of survival mode when a person tries to stop using. For a person who doesn't use drugs, you can very loosely compare it to doing a food fast. You know logically in your head that you can survive several days without food. However, if you try to go without food, your brain and your body work together to absolutely panic and tell you that you need to eat. You need to do that to survive. When someone is using opioids for a period of time and then they stop, that same sense of panic kicks in. Their brain, their body is telling them that they need that to survive. It has been hardwired in with those other basic tasks of survival. The other important thing to look at, like we kind of discussed, is that dopamine production has been shut off. Everything feels sad, terrible, awful. Makes it very easy for a person to convince themselves that the drug was the only thing making them happy, when in fact it has just replaced what has been with what should be naturally occurring for them. The good news is that given the chance to live, especially with life-saving medications like Narcan, people can recover and the brain can return to normal. Those additional opioid receptors that are created start to shut off within 48 hours and can be completely gone within less than 6 months. So the brain is back to a normal balanced state at that point. Dopamine production can return to normal between 15 and 18 months after use ends, and a person can be supported by antidepressants in the meantime if they know that this is what's going on with them and know to ask for them. And then the connections to judgment, motivation, and inhibition control centers can be reestablished around 3 years after stopping use. It's really important to know these timeframes because a loved one might be confused, right? Someone's been in recovery for 6 months or a year. Why haven't they addressed all these other issues or gotten a job? It's because that motivation center, that judgment center, that inhibition control center are still not quite connected all the way. So even though they're in recovery and they're not using substances, all those segments of their brain are not really functioning fully yet, and they need time to get back to that normal state. Okay, I realize I went through that a little fast, but before I get into the overdose response train, I want to ask if there are any questions.
Good information, Courtney. Thank you.
Thank you.
Any questions? You can unmute yourself. Just say your name, a first name if that's what you prefer. And yeah. So Courtney, I have a question
Yeah.
about, so for somebody who's on Suboxone, I have a family member on Suboxone.
Mhm.
He, every time he's tried to withdraw from it, he's actually relapsed, and I've reinforced that he really needs to do it under medical supervision, that
Mhm.
it's not easy to do. Do you know anything about then, is that, my understanding is that withdrawal from Suboxone is even harder than withdrawal from opioids, and I'm wondering if there's anything that speaks to Suboxone somehow getting into that receptor in a different way than even, let's say, heroin would. He had been taking heroin.
Mhm. Well, Diana, I've got to be honest with you. I am not sure. That's not something that I really discussed or
Mhm.
learned a lot about in my time here with TruthPharm, so I can't really give
Okay,
an informed answer to that.
I appreciate that. I also want to say that I'm really glad you brought out Portugal. For people who don't know,
I saw
it
the
really,
clap.
yeah, I did. Yeah, Portugal really had a problem with addiction and overdoses, and they did, as Courtney said, legalize drugs, and they have a very low rate now.
Mhm.
So thank you for bringing that in. Questions, comments? All right, proceed.
Okay. So now that everybody has kind of a foundational understanding of what substance use and addiction can do to the brain, specifically opioid addiction, we're going to talk about how to respond in the event of an overdose and what an overdose is and looks like. So to start, those opioid receptors that we talked about exist on the brain or in the brain on the mechanism that tells us to breathe. When too many opioids are present, it fills these receptors and the brain can no longer receive the signal that telling it that it needs to breathe, it needs to move the lungs. In most cases, the opioids' dominance over this system is a pretty gradual process occurring between half an hour and 2 hours after use, which gives us time to recognize what's happening and intervene before it becomes fatal. The important thing to know is that overdose deaths are preventable. We know this to be true. This is why we are here. This is why TruthPharm teaches this information and provides life-saving medication. This is why community members come out to get this information. There are some really important things to know about overdose. One of them is that it's more common for experienced users, which seems a little bit backwards. But the reality is that a new substance user is going to be really careful in their routine. As they continue in their use, become more experienced with this routine, they're going to get relaxed, become comfortable. They might not measure their doses carefully. They might not be as diligent in pausing between doses to make sure that they're still, functioning well. And someone might even develop a sense of arrogance and believe themselves to be impervious to risk. This is especially kind of typical for younger users who still have that sense of being indestructible. That 18 to 25 crowd, nothing's going to happen to me. I'm indestructible. So even the most experienced long-term users are at risk of an overdose. The other thing to know is that overdose isn't immediate. It happens over time. Like you said, that half an hour to 2 hour time frame. This is why we stress the importance of not using alone and encourage people to stay with their friends after use, or encourage people to check on their friends if they do have to leave after they've used. The other thing that we know about overdose is that it's frequently witnessed by people who could take life-saving action. This is, again, why we provide this education as much as possible. We want people to feel empowered to take action that can save lives. Part of empowering people to take action is letting them know about the Good Samaritan laws that exist. So these are the laws that protect people who call for help if an overdose occurs. These were designed to really protect the general public or anybody that might be around in the circumstances where an overdose may occur. And they are to the point where if you call for help to respond to someone who is overdosing and there are substances in that space where the police go, they're supposed to ignore them. They are supposed to respond to the overdose, the immediate situation at hand, and move along. So people should not be fearing any legal consequences for the situation that they're in when they might need to call for help during an overdose. There are also circumstances that increase the risk for an overdose. One of them is the loss of tolerance to the substance. This happens after someone hasn't used for even a short period of time, and those additional opioid receptors have receded, they've gone away, but a person uses the same amount of substance that they're used to. This then overwhelms the opioid receptors that are left and can prompt an overdose. This is seen often when people return to use after some time in recovery or after incarceration. So those are really tenuous times for people in recovery. There's also increased risk of overdose for people who are mixing their drugs, specifically if opioids are being used with in combination with alcohol or benzodiazepines. Those are both depressant and have the same impact on the respiratory system and breathing system. There's also concern about powerful additives like fentanyl, which act faster and are often unknowingly introduced to the body when they're mixed with other substances. And then any serious illness that impacts the respiratory system places a person at greater risk for an overdose. So something like pneumonia, bronchitis, or these days COVID could make somebody really susceptible to an overdose and a fatal death as the result.
Courtney, can I ask you a question before you go on?
Absolutely.
So if you go back to that last slide, your comment about fentanyl.
Yes.
So it's one of the reasons that the Catskill Addiction Coalition was distributing fentanyl test kits to active drug users, because my understanding is that many of the overdoses that are occurring from people whose heroin or substances laced with fentanyl, and it's just too much. Do I have that right?
Yes, TruthPharm actually has those available to active substance users as well. And we absolutely encourage anybody using any substance to use those test strips, because in our community and certainly in others, fentanyl has been mixed with all sorts of stimulants, which we'll address a little bit in an upcoming slide.
Okay, thank you.
So the absolute greatest risk of death for a person using opioids is using alone. This is really why we encourage people to stay together, people who may be using substances together, a person who doesn't use substances to stay with a friend or a loved one that is, just so that nobody is alone in the event that they slip into a state of overdose. We also encourage people to use really innovative tools to prevent the situation. One of them is the Never Use Alone hotline. I can provide that number at the end of this presentation. But it's essentially a hotline that a person who is using substances alone can call. They provide their name, their address, and then an operator stays on the line with them while they use, checking in on them every 45 seconds to make sure they're still responsive. In the event that the person on the phone doesn't respond, EMS can be dispatched to their location. This is a pretty new tool, and it's on a fairly small scale right now, but they have had 6 instances where they've had to dispatch EMS, and the person has been revived and has been rescued each time. So they have had no fatalities among the people who have used this service. So then the question is, what exactly are opioids, right? We are throwing that word around a lot. So what are we talking about? These are the drugs, medications that Narcan can respond to and help with. Most of them are narcotic painkillers. See heroin, morphine, OxyContin, Percocet, Vicodin. There's a whole array of them, and chances are that pharmaceutical companies will produce more over the years. We'll be adding to this list. It's important to know that these are things that you can find on the street and things that you're given from your physician. It doesn't matter where you get it from. They're all opioids, and they will all have the same effect on your brain functioning over time. But what about fentanyl or carfentanyl? Does Narcan work with these? The answer is yes. We often hear about these drugs and we hear them being described as Narcan resistant. It doesn't mean that Narcan won't work. It just means that it needs to be administered sooner and that a person might require more than one dose. So even when it feels a little overwhelming, like a person has been impacted by this stronger substance fentanyl, Narcan is still an option. It will still work. Narcan or naloxone does not work for non-opioid drugs, alcohol, benzodiazepines, clonopin, or ketamine, or with stimulants such as methamphetamine, cocaine, or crack. However, like Diana kind of brought us to, it's important to know that fentanyl has been mixed in with all of these other drugs in our community and certainly in others. It doesn't have a smell. It doesn't really look like anything. It just completely blends in and is unknowingly introduced to the body. So it's very possible that a person has taken a stimulant and has put opioids into their body, even if they don't know it.
So Courtney,
Yeah.
will Narcan have any effect if it's not got fentanyl in it? Will the Narcan naloxone have any effect at all on somebody who's OD'd on meth or cocaine or crack, even in terms of side effect?
Nope, because these substances
Different
affect such
receptors.
different areas of the brain and body, it won't do anything to change the course of an overdose for those drugs. It also has no negative side effects. It does not hurt.
Great.
And the reality is, at the end of the day, if you are in doubt about whether or not someone is experiencing an opioid overdose and you have Narcan on hand, try it. It's not going to hurt. There are no known adverse effects. There are no known instances of a person having an allergic reaction, and it's not going to interfere with any other non-opioid drugs in a negative way. So it is always worth a try if you're not sure exactly what you're being presented with. So how does it work? We're telling you to use it. You should probably know what's going on. Those receptors that we talked about in talking about the science of addiction, they're still there. And the brain of a person who has used opioids over time has too many receptors. There's an abundance of them. And an overdose occurs when the opioid fits in too many of those receptors and it eventually stops the person from breathing. Those signals from the body to the brain are stopped. The brain doesn't know it needs to respond anymore. Narcan or naloxone has a stronger bond to those opioid receptors than the opioid drugs do. It knocks the opioids out of place and blocks the receptors. This allows for the brain to receive a signal again that it needs to breathe. It's important to know here that the opioids are still present in the brain. They don't go away immediately. Narcan doesn't just banish them from the brain. The existing opioids will rejoin the receptors in time, removing some of the discomfort that's felt in the immediate moments when Narcan is administered. This is really important because if a person is revived with Narcan and then tries to use more substances immediately after to alleviate that discomfort, it greatly increases the risk of further overdose because they have what was already present in their system and whatever they're reintroducing. Narcan will bring on withdrawal symptoms for a person who has physical dependence. So it will cause some pain, some discomfort, some feelings of illness. But like we stated, it has no other negative effects and it cannot be used to get high. It will not cause harm if a person wasn't using opioids, if maybe you were not correct about the substance that's impacting this person. It's a little temperamental. It should be stored at room temperature and kept away from light. But a note about this, it will still work if it hasn't been stored to these standards at all times. In upstate New York, obviously, we don't advise keeping it in your glove box. That's too many extreme lows and highs. It may not be effective at that point. But if it's been left in your car one evening, got a little chilly, it's still going to work. So don't hesitate to use whatever you have on hand, even if you think that it maybe, wasn't at room temperature from time to time. Narcan also has a limited shelf life. I believe it's 2 years. So if your kit has expired, you're going to want to replace it. Again, it will still be effective after that 2-year point if that's all you have on hand. It's just not going to be quite as potent at that point. So if you're going to respond to an overdose, you need to recognize it first. You need to know what signs you're looking for. And the first thing to know is that it's possible to overdose, to have too many opioids in your system without needing Narcan. This means that there's some level of impact to your functioning, but not enough to constitute a medical emergency and an appropriate response. So a person might exhibit some confusion. They might act as if they're drunk or under the influence of alcohol. You might see some slurring of speech, non-coherent speech, pinpoint pupils, extreme sleepiness or nodding out. While concerning, these aren't behaviors that indicate a need for an emergency medical response with Narcan, primarily because you can get a response from that person. They are still responsive, able to communicate and react to outside stimuli. To address this sort of situation, you want to put the person in a rescue position, which we'll describe on a later slide. You want to not leave this person alone. We cannot stress this enough. At this point, there is no need for Narcan, but they could easily slip into that overdose state where they would need it. So you're going to want to make sure that they're not alone. And you're going to want to monitor them for up to 4 hours. They're really vulnerable here. If it's a person that you don't know, can't stay with, or it's something occurring in a public place, you might want to call 911 because, like we said, they're really vulnerable right here. You don't want to just walk away and leave them unattended, and you want to provide the support that they might need to get through this experience. And if you feel uncomfortable doing that monitoring yourself, you can certainly take the person to a hospital and they can receive medical care. It's just not necessitating an immediate response with Narcan as of this point. And then there are additional signs of an opioid overdose that require revival, so the use of Narcan or Naloxone. Here you'll see extreme sleepiness and nodding out without a response. That person is no longer responding when you try to get that from them. They can't wake up, they're not responsive, they're exhibiting slowed or irregular or even stopped breathing. They have cold, clammy skin or have a change in color around their lips or under their fingernails. If you come across a person who is cold, clammy, and presenting with that color change, that blue around their lips or fingernails, that is scary, and it might feel a little bit hopeless, as if there's nothing you can do at that point for them. The reality is that Narcan, even in this dire situation, can be enough to kickstart breathing again and be the thing that keeps them going until more formal medical care can be provided. So even in that circumstance, Narcan is always worth a shot. There is no circumstance where Narcan isn't the appropriate response. Here we want to address fentanyl overdose. We've talked about it a few times. It's often mixed in with other substances. And it has resulted in a lot of fatal overdoses in the communities where that's been present. Fentanyl overdoses have two really distinct characteristics that make them stand out from an overdose on other opioids. One is called a standing seizure. Essentially, a person is sitting upright or even standing, but they're otherwise unresponsive. There's a blank stare, they're not moving. Another characteristic of fentanyl overdose is what's called wooden chest, and it's exactly what it sounds like. The muscles in the chest become very rigid and tight and unmoving. And it's really the opposite of what you see with other opioid overdose, which puts the body into a relaxed, loose state. This is another way to recognize specifically if fentanyl has been mixed in with stimulants, they'll exhibit these signs and symptoms. And again, Narcan still works here. So if you recognize the signs of an overdose that require naloxone or Narcan, you're going to want to take action. You want to save a life. You're first going to start by attempting to wake up and stimulate the person. You're going to shout their name. You're going to place your hands on their shoulders, giving them a gentle shake, and you're going to try a sternum rub. A sternum rub is when you make just a bumpy fist with your knuckles and rub those knuckles right along that chest plate. It hurts, it's uncomfortable, even just doing it really lightly on yourself. So you can imagine that it would revive a person who is not responsive to other more gentle stimuli. The next step is going to be to administer the Narcan. So if you have a Narcan kit, it looks like this. It's a little blue bag. You're going to open a box and you're going to find a blister pack. It looks like this. And you're going to pop this little thing out. Well, first you're going to put your gloves on because safety first. Then you're going to pop this little thing out of that blister pack. Okay. There is no cap to remove when you take this out. It comes out ready to go. You're also going to be tempted to push this little plunger down here and do a little test spray, make sure that things come out. Do not do that. There is only one dose of the medication in this nozzle, and if you give in to your urges to do a little test spray, you're going to spray it out into the air and it's going to do nothing for us. So once you have your gloves on, you have this out, you're going to lay your person down. Lay your person down on their back if you can safely and quickly do so. You're going to insert this nozzle up their nose until this part of your finger touches their nostrils. You're going to want to make sure it's way in there. And then you're going to push the plunger up. That is going to spray the Narcan into their nasal cavity and get it where it needs to go. If you cannot position the person on their back quickly and safely, for example, if they're sitting in a car, it's fine, just administer the Narcan. The most important thing at this point is getting that medication into their body. Once you've administered the Narcan, you're going to want to put the body into the rescue position. This is the position most likely to prevent a person from vomiting and choking on it. So you're going to turn them to their side. You're going to put one of their hands to support their head and their face. That's going to keep them steady. And then you're going to take whichever knee is on top and kind of stretch that leg forward. Having that leg out stretched and off to the side a little bit acts as a counterweight. The person can no longer easily roll forward onto their stomach or turn over onto their back. Then you're going to call 911. You're going to tell them it's a suspected overdose. Being transparent with EMS professionals about the fact that this is a suspected overdose allows them to be prepared when they walk in the door. They will come in with oxygen and Narcan prepared to use rather than arriving and having to take the time to assess the situation. So it's really important to disclose what's going on. Next, you're going to provide rescue breaths. This is perhaps the most important part of responding to an overdose. During an overdose, the brain is not getting oxygen, and providing rescue breaths, giving that person some oxygen, could be the step that keeps someone alive or prevents brain damage. So to do this, you're going to place the person on their back and tilt their head until you can vision a straight line from their mouth down to their lungs. You're going to pinch the nose to seal the airway. Then, from your Narcan kit, you're going to open this little white package. This has a rescue breathing face shield in it. It looks like this. You're going to place this over the person's face, mouth, nose, making sure that you can read the letters from where you're looking at it. If the letters look backwards, it's on wrong. And then you're going to pinch the nose to seal the airway. You're going to inhale, breathe into their mouth 1 second, and watch for the chest to rise. You're going to continue doing this, giving one breath every 5 seconds. So you're going to count 1, 1,000, 2, 1,000, 3, 1,000. Inhale on 4 and push that breath out back into the other person on 5. We, of course, know that it's a little unsettling to think about putting your mouth on someone else's mouth. That's why we include these. And the reason it's important to pay attention to the way that you position it so that you see the letters on your end, because this filter is one way. It allows you to push oxygen into that person's mouth, but it doesn't allow for anything funky to come back up at you. It keeps you safe. And you're going to keep doing this for as long as you need to. Initially, you're going to do it for about 2 minutes. We know you're not pausing to set a timer. There's a bit of a crisis on hand, so whatever feels right for 2 minutes for you. You're going to keep doing those rescue breaths, that 1, 2, 3, inhale on 4, pushed out on 5. And then if you have a second dose of Narcan available, you're going to administer that at the 2-minute mark as well. If you don't have a second dose of Narcan, you're simply going to keep providing rescue breaths until help arrives. Remember, at this point, you've already contacted EMS. They're on the way. Once everything has settled down and everybody's safe, it's important to report that you've used your Narcan kit. You can do this by calling the number on the back of a blue card. I don't have one on me, but there's a little blue card in your kit. And this card also makes your kit legal and certifies you to carry it. Calling and reporting that you've used your kit allows for you to get a replacement, so you have a new life-saving kit of medication on hand. And it also allows for the agency that provided it to report that it's been used. Programs like TruthPharm and others that distribute Narcan can only keep doing this because we demonstrate that it's being used to save lives in the community. I know that it feels like an extra step, especially after something so big and scary has happened, but it's really important to report when your kit is used, to support programs and for you to have a kit available for use again. Now, once you've used your Narcan kit, you've administered that to a person who's experienced an overdose, there are some pretty normal responses that you'll see. Primarily in talking with people that have experienced an overdose, almost nobody realizes what has just happened. They just wake up and there are suddenly people standing around them, whether that be peers, police, or medical responders. That understandably prompts for a person to feel upset, confused, anxious, scared. People that have developed a physical dependence on opioids might also exhibit physical symptoms: body aches and pain, vomiting, shaking, sweating, as a result of the sudden disruption of the presence of this in their systems. A common question that we hear from people who are learning how to administer Narcan is, will the person be angry or violent? The answer is almost never. Local EMS providers down towards Binghamton have reported very few instances of angry or violent reactions over the course of hundreds of overdose responses. And it's been suggested that when people are angry or violent, it's as a response to the circumstances that they're waking up to, that feeling of being surrounded by people, particularly law enforcement officers, and not really anything to do with the naloxone administration itself. So when a person comes to after you've used your Narcan or naloxone, you're going to treat them like you would treat a little old lady that just fell down in the streets. You're going to tell her what happened. You're going to tell them what happened, explain that you're there to help, and be as reassuring as you possibly can. This is a really scary situation. You might also explain to them that while they're feeling uncomfortable, the effects of the Narcan will wear off in about 45 minutes. They're going to feel better. Any further use of a substance before then might prompt a second and more severe overdose. So it's really important to stress this. And the next most common question that we have that I will just get out of the way is how to receive a Narcan kit. Now that you know how to recognize the signs of an overdose and respond with Narcan, you need to know how to get a kit. So you can go to most pharmacies in New York State. There's a list of them on the New York State Department of Health website, and receive a kit without a prescription. Under New York's Naloxone Copayment Assisted Program, or the NCAP program, New York State pays up to $40 for this. So if your copay is $40 and under, or if you're on Medicaid, receiving a kit is free. If you have trouble doing this, please let us know at TruthPharm. We do inform the state when pharmacies refuse to provide kits or put up other barriers to receiving them, which is especially important in small communities that have no other route to access this medication. So we want to advocate for communities to be able to access this easily. The second option is to contact local organizations. So TruthPharm, the Catskills Addiction Coalition, and the Southern Tier AIDS Program are all trainers and providers of Narcan kits, and they can be mailed within New York State if you do not have the ability to get to any of those organizations to receive them. And the last way and most simple for today is to complete the Narcan training record that Diana has dropped a link to in the chat. So I'm going to ask that everybody that was here today, whether you need a kit or not, please fill that out. That allows us to tell the state the number of people that we've trained, the number of kits we've distributed, and how many people are going to choose to go to the pharmacy to get their kit, things like that. It's really important to help keep this program going. So please take a few minutes to do that. We also have an evaluation form in the chat as well to tell us, you know, how you felt about this experience today, and allows us to change and learn and grow as an organization to tailor this to what people need.
Yes, I'm sorry, I have screwed. I've created too much confusion here. There's the form for the evaluation in the chat box. The first one I posted for the Narcan kit was the evaluation link, I think. Anyway, I'm going to post it one more time and to make sure that we have the right thing.
And if anybody doesn't receive the evaluations, they can certainly email truthpharm@gmail.com and say, hey, I was there today, I didn't get the right links. We can send those out. That's not a problem.
And Karen has a question.
Yes, I see that.
Karen?
Oh, yeah. I'm sorry, Courtney. I wasn't sure if anybody asked this or not, but you were talking about the blue cards that you include in the kits, which is great. I didn't know you did that. But if somebody used Narcan and they're in a situation where they're worried about their identity and they request more Narcan, will their information be kept confidential?
I am not super sure, Karen. I'm not sure exactly what details get reported to the state. I do believe that it's just numbers.
Okay.
So we report out, you know, how many kits we've distributed. But like I said, I'm still new over here, so I'm learning about all of it.
Yeah, I have no idea either how that works. So I thought, well, I wonder if if that information is made available to organizations or how that even works. So
I see that Alexis just responded in the chat. She's over here saving me. It is confidential. They only ask for demographic information, demographic and geographic information.
Oh, okay,
so
good.
That's all that we report out to the state.
Good. I learned something. Wonderful. Thank you.
And Dottie Howe has a great question. Dottie, do you want to just ask it? Or I can ask it.
Hold on. Okay. Can you guys hear me?
Yes, we can.
Okay. Yeah, I was trying to click it. Couldn't get it fast enough. Okay, yeah, I know TruthPharm, I'm guessing, probably primarily serves Broome County, I'm thinking. I don't know. I know you guys are based there, but we're having a real problem getting Narcan in the Walton community, regardless of what anybody's saying. And even EMS has been on calls for overdoses without Narcan.
Wow.
And had on the streets, if you will, by people that have had Narcan. So, there is a person who is very trusted and who has been handing out Narcan and is trained in everything. And I'm just wondering, I don't know, could TruthPharm be a resource for him if he contacted to get some?
So I'll jump in.
I see Alexis cut her video on, so I was gonna defer to her for that one.
And Alexis, introduce yourself.
Hi, I'm Alexis Plussin. I'm the executive director of TruthPharm, and Courtney did an amazing job.
Yes, she did.
She did.
Yeah,
Very
bravo,
well spoken.
brava, like beautiful job. So Dottie, I guess when you started to ask the question, or when I saw it in the chat, I was like, oh, well, I know Dottie and I trust her and blah, blah, blah. We could talk about you becoming possibly a certified trainer with TruthPharm. We can't just in regards to like the fellow that you're mentioning, I don't know where he's getting his kits from now, but we aren't able to just simply be a distributor for kits. Like we have to train and certify trainers, and then we have a lot of record keeping that we have to do. We have done that with some folks because we want it to get to communities. So we have a couple of trainers in Shenango County that we've trained and we stay in close contact with, and they abide by policies that our organization has set up. So I'm certainly open to doing that with someone in Delaware County. We're just super careful, as you know, in terms of like making sure that people align with TruthPharm's ideals. We're not going to certify someone who doesn't wholeheartedly support harm reduction in every way, and that we can trust to do record keeping and all of that, if that makes sense.
And the Catskills Addiction Coalition, Dottie, would be happy to work with you. We're working with TruthPharm as well, but we would be happy to look at how can we deal with this. We're part of a federal grant that Reach Medical has, and Reach Medical actually, there's going to be a session, the next session, Zoom session is on low threshold medication assisted therapy with the physician from Reach Medical. They have a federal grant that we're a part of, TruthPharm is part of, that looks, and part of what we're accountable for is doing Narcan training in the community and distributing it. So I would say let's follow up with that with Julia Reichel and Dennis Morgan and see what we can do to help bump up both EMS's preparation as well as whatever else you need in the Walton area.
Okay, yeah, I mean, I can be the go-to person, you know, because I want to make sure
Great.
that everything's on the up and up, especially when we're talking about federal money.
Great.
But yeah, that's okay. And I did want to say that Courtney did a very good job speaking. She was very clear, thorough, very well spoken. You're a great public speaker.
Thank you so much.
Yes, excellent. Other questions or comments? We've got about 3 minutes left. This is such an important topic. I really appreciate TruthPharm doing this training and all that you do at TruthPharm. As I mentioned at the outset, we're learning a lot from you, and I'm quite grateful for that. Yeah, but so if people would like to learn more about TruthPharm, how would they do that?
So we have a website, it's truthpharm.org. We're also very active across social media platforms, particularly our Facebook and Instagram. Facebook, you can find out about our harm reduction works meetings and other volunteer opportunities, or our services, anything that we offer. We're also pretty responsive via messages from those sources as well. For those that were interested in, this afternoon session and what you learned, we are presenting our Shauna Has a Secret education series tonight, which is geared towards caregivers for adolescents, and recognizing the signs and symptoms of substance use in teenagers with a harm reduction focus. And then we also have upcoming our Clearing the Confusion series, which is a 10-week educational series designed for families and loved ones of people who use substances, helps kind of unravel the mysteries of substance use, understand the different forms of treatment, how to access them. We talk about productive conversation and healthy boundary setting, and that was all via Zoom each Wednesday from 6 p.m. till 7 p.m. starting January 20th.
And there's another question here just before we go. It doesn't matter what county you live in order, if you are on this webinar, you can get mailed the Narcan no matter where you're at. Is that right?
Yes, as long as they're in New York State, we can mail a kit if it's not possible to do an actual drop off.
Great. And could you, let's see, before we leave, Taylor asked, I'd like to say something about the question of why Suboxone is harder when in withdrawal than opiates. Okay, very quickly. And can you quit sharing your screen, Courtney, and I'll put up your other confusion. So Taylor, speak.
Hi.
So I'm here with SUNY Delhi. I'm one of the students, but I've done a lot of research on addiction, substance abuse. So I just wanted to share the question that you had before
Thank you.
about, when people say that it's harder coming off of Suboxone or Subutex than it is coming off of heroin or other opiates. So the reason for that is Suboxone and Subutex have naloxone in it. And naloxone attaches to the opiate receptors much harder. There is more of a connection than there is with regular opiates. So it's a stronger connection, and it's feeding those opiate receptors a lot more. So when someone is coming off of opiates, they have the drug of choice usually has a shorter half-life. So they're experiencing their withdrawal symptoms much quicker and coming off of that much quicker. But with Suboxone and Subutex, there is a longer half-life. It's usually about 37 hours. So people are going through the withdrawal much longer, and the symptoms are often much more harsh to a person because of the fact that those opioid receptors were just so attached and so strongly bonded.
Taylor, thank you. That was an excellent explanation. I really appreciate that. Thank you so much.
You're welcome.
And with that, I want to just thank everyone for participating today. Again, you can go to that chat box and download that chat. You can save it and download it. Just go to the three buttons down there and you'll have the option. And I want to thank Courtney Hayes for an excellent presentation today. Courtney, thank you so much. And you're also willing to make your slides available. Is that true?
Oh, I'm not sure.
Oh, okay. Well, we'll work that out. But this video will be on the Catskills Addiction Coalition's website. Give us about a week or so at catskillsaddictioncoalition.org. That's catskillsaddictioncoalition.org. Thank you so much for this, for doing this today. Stay safe, everybody. Everyone. Stay safe.
Hey, Diana, can you stay on for a minute? I just need to ask you about one of the presentations this afternoon.